Today I want to talk about something that is super important for us sickle cell warriors, and that is exercise. It's something that we know that is good for our bodies, but with sickle cell, we have to be careful. Exercise can both be a benefit and a risk, so understanding this balance is key. Exercise has a lot of benefits, such as improving circulation, boosting oxygen levels in the blood, and helping to keep our muscles and joints strong. But with sickle cell anemia, there are some risks that we need to consider before just diving into a workout routine. We will be going over the risk factors of exercise, key factors to consider before exercising, and the importance of exercise for sickle cell warriors. Here we go. Different forms of exercises come with different levels of risks. For instance, high intensity exercises like running or weightlifting or anything that requires an extreme endurance can actually increase your chances of having a sickle cell crisis or cause unwanted symptoms such as being breathless, feeling nauseous, having joint pain, muscle pain, a headache, or anything that can surface as a result of low oxygen levels. In a study published in 2019 regarding the beneficial effects of endurance exercise training on skeletal muscle microvasculature in sickle cell disease patients, stated that a moderate intensity endurance exercise training program improved the muscle capillary network and partly reversed the microvascular defects commonly observed in skeletal muscle of sickle cell disease patients. Simply put, moderate intensity exercise can help people living with sickle cell form new blood vessels in the muscle, assisting with oxygen delivery. Intense physical activity requires more oxygen, and when your body can supply enough, this is when sickling of the red blood cells occur, blocking blood flow and causing pain. Starting slowly and then gradually increasing your intensity and duration over time is recommended. A 30-minute high-intensity exercise is way too harsh on the body. Doing a 1-minute high-intensity exercise woven into a 30-minute exercise routine can be way more effective, and that will total up to, say, 3 to 5 minutes of a high-intensity exercise. Of course, work up to this. You can say start off with 10 seconds of one type of high intensity exercise, assess your body, and move up from there. Not everyone will be able to do 1 minute of a high intensity exercise, and it is certainly advisable not to push yourself. An expert analysis from the American College of Cardiology mentions in an article entitled "Sports-Related Sudden Non-Cardiac Death" concluded, in fact, athletes with sickle cell trait are at 40 times greater risk of exercise or sports-related sudden death than those without. In these athletes, exercise-associated sickle cell collapse often mimics heat stroke but occurs earlier in exercise or while indoors. This is for those with sickle cell trait. For those with full-blown sickle cell diagnosis, I'm sure the numbers would be higher.
Individuals with hemoglobin SS wouldn't be able to tolerate the demands of professional athlete levels of performance.
This type of intense physical activity is very challenging, but is possible with a diagnosis of SC and not SS. There are a handful of athletes that do have sickle cell, but in saying that, the diagnosis is SC and not SS. A review published in 2020 regarding physical exercise and sickle cell anemia concluded that low to moderate intensity physical exercise increased the sickle cell anemia individual tolerance without causing vaso-occlusive crises nor changes in the hematological and inflammatory profiles. So moderate to low intensity exercises such as walking or some yoga are more manageable due to the reduced exercise capacity and tolerance. As long as you aim for 20 to 30 minutes of some sort of physical activity daily, you have a greater chance of improving your blood flow, strengthening your muscles and joints, enhancing your mood, and increasing your tolerance, which will help to increase your resistance, endurance, and overall well-being. So you don't have to engage in high-intensity exercise to benefit from better oxygenation of your cells. It's not for everyone, but If you can experiment with different types of exercises, you may find that it can help to reduce many unwanted symptoms of sickle cell, such as fatigue and weakness and painful episodes. Bursts of high-intensity conditioning can help to increase your oxygen consumption, which is associated with a longer life and a healthier heart. I've experienced being breathless, feeling nauseous, dizzy, lightheaded. There's been times where I've gotten a headache, felt weak, had cramping or pain, and have developed a crisis during exercise on more than one occasion. But with all of these experiences, I have realized that there are other factors that have played a role. Some being the duration from when I last exercised, how hydrated I've been, along with making note of my stress and immunity levels at the time, and even how these have been days prior. When I engage in high intensity workouts, they are usually split throughout the workout, so it's not done all at once. I find that incorporating a warm-up, a cool down, and stretching portions to your routine can be helpful and can give you a more all-round session. Here are some critical factors to consider before starting any exercise routine with sickle cell. Age. Younger individuals may have more resilience, but as we age, our bodies need more care. I'm currently in my early 40s and has felt a difference in my body, which made me put more emphasis on exercising so that my bone mass, strength, overall circulation, and mental well-being does not suffer. Hydration levels. Dehydration increases the likelihood of cells sickling, so always hydrate before, during, and after exercise. Organ health. If you have major issues with organs like the lungs, heart, or kidneys, it's crucial to adjust your exercise intensity. Last crisis or treatment. How recently did you have a sickle cell crisis? How recently did you undergo treatment? Your body needs adequate time to recover before exerting itself again. Everyone would have their own time frame, but generally speaking, at least a week or two, depending on the severity of the episode, and sometimes even more than that. Medications. Certain medications can affect your stamina or your body's ability to manage oxygen. Your regular routine. If you're not used to exercise, starting slow and going at your own pace is extremely important. It's important for us sickle cell warriors to keep moving, so please keep moving. Red blood cells are produced in the bone marrow, and exercise helps to stimulate its growth. Consistent physical activity can also trigger the release of hormones that help to boost hemoglobin production. So, move your body, build your blood. When we engage in exercise, our breathing deepens, which helps to increase oxygen levels. For us sickle cell warriors, this is so important because the more oxygenated our red blood cells are, the less likely they are to sickle. And breathing is so critical. The way we breathe can have a tremendous effect during exercise. Shallow or fast breathing can actually do more harm and counteract all those beneficial effects that you're trying to achieve. And so remember to breathe deeply, rhythmically, and exhale on any sort of contraction or stretch. At the end of the day, exercise is an important part of managing your health with sickle cell anemia, but you have to be careful. Always listen to your body, start slow, adjust your durations, be mindful of your breathing, and stay hydrated. I'd like to leave you with a quote from Dr. Kenneth Cooper, who coined the term aerobics. We do not stop exercising because we grow old. We grow old because we stop exercising. Thank you so much for watching. I truly hope that this video has provided you with insight on exercising with sickle cell. Please like, share, and subscribe, and remember to stay strong, stay mindful, and keep moving in ways that support your unique needs. Blessings.